Well, last week it was a historic first. The U.S. Surgeon General issued an official warning about skin cancer, calling it a major public health problem that needs to be addressed immediately. So let's address it. Let's talk about it. I'm joined now by Dr. Jennifer Pennoyer. She's a dermatologist and a staff physician at St. Francis Hospital, and she is at the forefront of this field. So thank you so much for joining us today. A pleasure to meet you.
Thank you for having me, Tim.
I always get a little perplexed by skin cancer because it seems like it's something that a lot of people know about, and yet the problem is growing and growing and growing, and now I guess it's about 5 million new diagnoses every year. How bad is that?
It's crazy right now. 1 in 5 Americans will have skin cancer in their lifetime. And if you look at the total number of new cases of skin cancer in a year, it is more than the combined incidence of colon, breast, prostate, and lung cancer. All those combined. It's crazy. It's an epidemic.
Unbelievable, and yet it seems so eminently avoidable. But that's the thing with skin cancer. We were just talking before. I'm guessing most of you out there know you probably need to stay out of the sun. You need to put on sunblock. You know what you need to know to avoid skin cancer. Why is nobody doing it? And myself included. You know, I got a nice little tan myself.
I think people are doing it. I think the education is not exactly been consistent. That we need SPF 30 or greater. That you have to reapply. It is hard. If you put on your sunscreen first thing in the morning, it isn't going to last all day. The sun is stronger than when you and I were kids. We're losing our ozone, so what's hitting us is much stronger. And you and I are getting damage in and out to the car, in and out to work and errands.
Little things add up.
Even though we're not sitting on the beach, you're getting damage.
How much sunblock should people be putting on?
You know, what you really recommended to do is a shot glass full, and you're going to apply that full body a half hour before you get outside. But also the most basic things. Sunglasses, a hat, sun protective clothing. Just make it easy for yourself.
Do you find it hard battling public perception, trying to tell people that literally sunlight is a carcinogen? That just doesn't seem to make sense to a lot of people.
Especially in Connecticut. We only have about 6 months of sun, so people are just dying to get out there and get some color. They're tired of looking pasty. You know, you got to remember that when your skin turns red, even one sunburn increases your risk of skin cancer down the line, and it's all cumulative. Your skin has memory. It all adds up from day one.
Now, there's a number of different skin cancers. There's basal cell carcinoma, squamous cell. Melanoma is the one that seems to be the biggest killer, even though it's not the most prevalent. Why is that?
You know, melanoma is the scariest of them all. The incidence has gone up 200% since 1973. That's crazy. We need to really protect ourselves, and that's due entirely to too much cumulative sun exposure.
Is it that melanoma is that deadly, or is it just that people don't find it until it's progressed past the point of no return?
It's both of those things. You really got to watch out for what's changing on your skin and the ABCDs of melanoma.
And that's what I want to get to today, because that's something a lot of you may not know. This is how you try to determine what's a mole, what's a blemish, and what could be skin cancer. You mentioned it, A, B, C, D, E, Dr. Pennoyer. Why don't you take us through what they mean?
A is asymmetry, so if a lesion is on your skin, you want one side to match the other if you were to fold it in half. B is border. A clear border is really what you want. If something is growing out one side, you frequently have like a gray or cloudy area, or it looks red or inflamed on one edge. C is color. Blue or black we really don't like. And D, diameter. Usually you would say greater than a pencil eraser is something to be worried about. That being said, some people make all their moles big, but so what's a different diameter than the rest of what's on them? E is evolving. Now we've added E.
Things have changed.
Where if it's something that's evolving and changing.
Okay. If we could, let's see, can we bring up some of those pictures that we had of different types of skin cancer? I want to take a look. Real quick, what do you see there as far as A, B, C, D, E, doctor?
Those aren't melanomas. That's a basal cell right there. The one previous to that was a squamous cell carcinoma. This is a melanoma with the irregular pigmentation.
There you go.
You see areas where it's regressed. There's no pigment whatsoever. It goes from black to really thundercloud gray. That's the squamous cell. But those are things that keep growing, growing, growing. You know, in general, the skin cancers don't go away.
How about a monthly body scan?
I think it's important for all of us to look all over and know what's on you. You know, as you're toweling off or putting suntan lotion on, you're going to look around and just know, oh, that looks darker, that's new. Or certainly if anything bleeds or changes, take notice of it.
I've heard about different things. I think melanoma is a bit of a problem for people who are African American, which sounds counterintuitive. Do I have that right? And if so, why is that the case?
You're correct. They have a much higher rate of melanoma, specifically on the edges of the palms and soles. So any skin type really is getting damage from the sun. Even though people tan very easily or are darker skin toned, their risk is still there. It's really all of us. Skin cancer doesn't exclude anybody.
So those are the takeaways too. There's no such thing as a tan versus a burn. It's all a burn. And then if you're looking around, I guess what I'm gathering is you want to look for irregularity in something that's changing. I guess your regular moles are a lot more well-defined and they look circular.
And we tend to make our moles in a certain way, you know.
Okay, well, doctor, thank you so much for your time. A pleasure.
Thank you so much.
The kind of word we just cannot get out enough because unfortunately so many of us are not really getting the message. So hopefully this will help.